Last time you were here, we were talking about hantavirus, and there were some headlines about Ebola at this point. Just today, a Kenyan high court temporarily blocking the government from approving a deal with the U.S. to establish an Ebola quarantine facility in the country after a human rights group said the plan posed, quote, grave health risk to the public. Was this the right move of the United States to try to keep Ebola out of the U.S.?
It was the opposite of the right move, because what we know is that we have a whole network of places that can take care of Ebola patients that were built exactly for that purpose.
Here in the U.S.?
In the U.S. There's at least 13 of them. There's one right here in New York City at Bellevue. And they've taken care of Ebola patients before. They drill on this. They train on this. This is what they're actually designed for. That's what millions of dollars were spent to create. And it makes no sense to have them lie fallow and you try to create something ad hoc in Kenya, which is going to deliver nowhere near the standard of medical care necessary to take care of Ebola patients. And
there's also a concern about the people who are going to staff these centers. We're getting something like 3 days of training versus people who've studied containment for years. And someone else was saying there's another concern that, to your point, it might actually make it worse, because if one of these volunteers were to accidentally get exposed or potentially exposed, they might be disinclined to report that so that they can go home at the end of their tenure rather than they themselves then getting stuck at the same facility.
Correct. There's lots of different hazards that occur. Not only does it encourage people to not report any kind of exposure, it also will disincentivize people from going to the outbreak zone to extinguish the outbreak. And we know the only way to end this is to actually end it at its source, to get resources to the DRC so that this ceases to be an issue for anyone.
There was a comment that the Secretary of State Marco Rubio made earlier this week at the cabinet meeting that got my attention. He said, quote, "We cannot and will not allow any cases of Ebola to enter the United States." That seems like a really difficult thing to control. Like, saying that kind of sets you up for like, wait a second.
But it sort of says that they're fixated on this number of 0.
It reminds me of 2020 and the COVID pandemic.
Exactly. It's kind of a distraction, because we know that there may be exposures from doctors, for example, that go there. And that means that those people are not going to be repatriated, because it's going to blemish that record of 0. And I think this is kind of putting politics ahead of medical care. This is not something that makes any sense. As I talked about earlier, those Ebola treatment centers in the United States, they've taken care of multiple Ebola patients during the 2013-2014 outbreak. They had no secondary cases. It was done safely.
And with pretty good outcomes, right? I think most of them that were treated here did recover, correct?
Almost all. Only one person died. That person was transferred very late, but everybody survived. These are the top-notch places. It's like if you had a stroke, you want to go to a comprehensive stroke center. So if you have Ebola, you want to be at one of these biocontainment units. That's exactly what they're made for, and it makes no sense, 0 sense, to just have them sitting there doing nothing.
What do we get wrong about Ebola? And the way I use the term "we," I just mean like lay people, and the way we think about how contagious it is, how deadly it is. I think a lot of people think it's this far off disease.
Well, I think what people get wrong is mistaking deadliness, headline grabbingness, scariness for contagion. So yes, Ebola is contagious, but not very contagious. You get it only from exposure to blood and body fluids, and that's blood and body fluids from people that are actually sick. So when you're looking at it from a pathogen perspective, that's not very efficient transmission from person to person. So it takes very simple measures to stop an Ebola outbreak. It's just that in that area of the DRC, they can't even do that right now, and this outbreak has had a 4-week at least head start. But Ebola doesn't find many countries hospitable because of how constrained it is when it gets from person to person. But it's always going to grab headlines. It's always deadly and dangerous. But on a pound-for-pound basis, it's not something that qualifies as a pandemic threat.
One of the reasons transmission is hard to stop in some of these places is because you're fighting not only the virus replicating, but you're fighting the replication of misinformation and disinformation a lot of times. How much of an impact is the lack of USAID structure in a lot of these places? These volunteers who, even if they're not healthcare professionals, would have reported back to the Capitol, would have called someone in Kinshasa and say, we're seeing cases. Just that infrastructure to distribute information, how big of an impact do you think that's having on the spread of this disease?
I think initially, if USAID was on the ground there, this virus would not have had that 4-week head start. It might not have been that USAID diagnosed it, but they would have said something is up here, and that would have alerted people to bring more resources to try and investigate what's going on. So that's definitely the case, but there is massive amounts of disinformation. This is an area that had an Ebola outbreak several years ago that was marked by people being killed, by Doctors Without Borders having facilities burned. That same thing is happening now. I think there's at least
already burned a hospital.
three of them. Yes. So this is very, very difficult to deal with. It's very dangerous. And there was lots of disinformation, people who don't believe that Ebola is actually a thing. That's all going to complicate this. And that's why it's going to probably take months to get a handle on it.
How is Ebola treated? And I ask that with the context of also the question about vaccinations and if those are being developed.
Maybe how should Ebola be treated? Because we
Yeah.
know it's treated a couple different ways.
So the mainstay is just supportive care, and it's not just supportive care. It's IV fluids, it's electrolyte replacement, it's fixing the dehydration, controlling the fever, controlling the vomiting. That goes a long way to decreasing mortality. We do have specific antibodies that we give people for a different strain of Ebola. There are 6 species of Ebola. The one that's causing this outbreak now is a rarer strain for which we don't have specific antibodies for and we don't have a vaccine for, but we've been able to stop Ebola outbreaks in the absence of those countermeasures for a very, very long time. It's really just about making sure resources are there. And there will be clinical trials. There will be experimental drugs tried on this species of Ebola, and that's already ongoing. The American that's in Germany right now being treated is getting a treatment, a monoclonal antibody.
Dr. Adalja, thank you so much for joining us. I think we're going to keep having you on. Hopefully, we'd like to see this under control, but I think it sounds like you think we've got a while yet to go.
Yes, I think it's going to be months.
Oh, gosh. All right.
Months and like, where are we on the curve, do you think?
I think we don't even have full situational awareness. We don't actually know how big it actually is because this had lots of momentum before anybody even got there to really survey what was going on.
Dr. Amesh Adalja, from the Johns Hopkins Center for Health Security at the Bloomberg School of Public Health. He's a senior scholar there. He joins us here in the Bloomberg Interactive Brokers studio. The Bloomberg School of Public Health, it is supported by Michael R. Bloomberg, founder of Bloomberg LP, the parent company of Bloomberg Radio.